If you are a nursing student, you go to class, you take your notes, you go home, you study, but then you see your grades at the end of the semester and you're like, what the heck is this? Why is that my efforts are not matching my exam grades? This video is for you. Hey, future nurses. My name is Dr. Nurse Vicky, and in today's episode, we are going to go through the 8 different question types that you need to know for your exams. So basically, every exam, whether it's your professor's exam, your NCLEX exam, or whatever board exam you take, there are 8 different question types. But your professors will not tell you this. I decided to break this down in today's video so that you can finally study the way you were expected to answer questions. Now, if you see me looking down, I have my iPad here and I decided to take notes to write everything down so that I don't miss a point. So follow along, take your pen and paper and write down everything that I have to say because trust me, you probably don't know any of this. So there are 8 different question types that you will see on your exams. Once you know these 8 question types, you will mirror the way that you study to be able to recognize these different question types in your exams. So let me just go through all 8 and then I'll break it down step by step. The first one is recognition, progression, priority, safety or risk, intervention, evaluation, teaching, and delegation. So these are the 8 different types of questions. Perhaps you have heard about a few of them, right? For example, is priority. We always focus on this in nursing school. Know your priority nursing action. But guess what? Priority is not the only type of question that you will see. So let's start with the first one. So the first type of question is recognition. Now, anytime I teach my students, I always tell them this. Remember that your patients don't come to the hospital with their diagnosis on their forehead. They come with signs and symptoms, and then we may do diagnostic tests, we may do labs, and then we will try to figure out what condition is this. So that is it, recognition. Are you able to recognize the condition based on the signs and symptoms that they are giving you? For example, your patient have high level of ketones. Your patient is having cosmos respirations. Your patient is having an increase in urination, an increase in appetite, and your patient is having metabolic acidosis. What condition am I talking about? You may start to think about maybe DKA because you heard ketones and then you saw the signs and symptoms of diabetes like polyuria, polydipsia, and all that. That is recognition. So when you study to recognize, and that is why we need to have cardinal signs and symptoms. What differentiate this condition from this? So know your cardinal signs and symptoms. That's the first type of question. Number 2 is progression. Now, I want to talk about this in 2 parts, progression based on your patient and progression based on interventions. Let's start with the patient. When I say progression, I mean what is next? What will be some of the complications that will happen if we don't treat this patient? For example, your patient is bleeding out, right? Your patient is hemorrhaging. So here, you know that it can progress hypovolemic shock. How do you know that this is hypovolemic shock? You also need to know the signs and symptoms when it is progressing. So let's just say that the scenario is your patient is hemorrhaging, blah, blah, blah. All of a sudden, your patient is having oliguria, hypotension, tachycardia. These are clicking here. This is progressing into a complication. So here I can say that, all right, my patient is now having hypovolemic shock. So that is from the patient side. Now from the intervention side. In terms of the interventions, you ask yourself this question: what should I anticipate next? So let's use the same example. Your patient is having or going through hemorrhaging. Now you ask yourself, what should I anticipate? Maybe blood transfusion, so that we don't end up with hypovolemic shock. Does it make sense? I hope it does. So the first one that we went over was recognition. Now you need to know progression, your complications, how does that look like, and what you should anticipate for your doctor to give you or orders that will follow next. If you are liking this video, don't forget to comment down below. Let me know that you are loving the video. And also, I designed a full course that is going to take it a step further for you. So click my link in the description and you will find all the links for you to grab it. Number 3 is priority. We always talk about this. Students will come to me and they were like, I read the question and guess what? All the options look correct, but then you're looking for the most correct. So the priority nursing interventions, most times, all of the options are correct, but they are trying to ask you what is the most important intervention at the given point in time. Now, here is what I normally tell my students: practice, 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 practice. When you're studying, practice prioritizing your nursing interventions. And when you're doing more questions, you are able to build that skill to know which intervention am I doing first. So that is priority. Number 4, safety. This is a type of question that they're trying to figure out. Do you know how to stop, recognize that this thing is wrong, and think about it? So let me just give you an example. Safety questions are a bit different from priority and recognition. When they're asking you about safety, basically they want you to pause for a moment and recognize that this intervention or this thing is not right. Let me give you an example. Let's just say that your patient is on digoxin and you go and check the apical pulse and you realize that the apical pulse is less than 60 beats per minute. Safety will tell you, let me stop. I should not give this medication. Or safety will tell you that, okay, the apical pulse is fine, it's 70, so I can give this medication. So that's safety. Pause and think as a nurse because something will not be right. For example, let's just say you're giving your patient furosemide. You know that furosemide or Lasix is a potassium wasting diuretic. You have to check the patient's potassium level. If it's too low, you have to pause and think and be like, this is a safety issue and I cannot proceed with a furosemide, or I need to fix the potassium issue. Number 5, intervention. Now, intervention is a bit different. In this case, they give you different types of interventions that you can give your patient, but this time, all of them are different. There is no priority here. Just choose the best intervention for your patient. So different ones are wrong. Let's just say your patient is having respiratory distress. In what position are you going to place your patient in? They have lithotomy, they have supine, they have high Fowler's. What are you going to choose? Obviously, high Fowler's. There is no distractors here. It's just straight to the point. Know the interventions per conditions. Number 6, evaluation. Now, most times I see this with pharmacology questions, whereby they're asking you the desired effect of the drug. Has it been met or not? So if we give our patients, for example, a bronchodilator, we need to know that, okay, this medication, the desired effect is what? Our patient may be having respiratory distress, and now it has dilated the airway and your patient is breathing just fine. Now, here is a trick that comes here, is that sometimes you are unable to recognize the medication or the intervention and you're scrambling. So here is a trick that I like to tell my students: look at the condition. So if it is an asthmatic patient and then they have a medication that you don't know, you know that whatever medication that you're going to give needs to fix this issue of asthma, and that's the airway may be inflamed, it needs to be dilated. So either or, this may be a corticosteroid or this may be what? A bronchodilator. So with that, it can help you narrow it down. So that's it when it comes to evaluation. Number 7, patient's education. You guys, this question, most times you will see it as like a discharge type of question whereby they're asking you, about a certain type of diet. So for example, a patient who has chronic kidney disease is currently on magnesium containing antacid. What are you going to do as a nurse, or how are you going to educate your patient, right? So that is how the question is structured. You will tell your patient, hey, don't take magnesium containing antacids, because we know that in CKD, that's chronic kidney disease, your patient will have hypermagnesemia. Another example here can be like, which patient need further teaching? Or what statement by the patient means that the patient needs further teaching? Or which statement is correct by your patient? So however they want to frame this, it's all about teaching. Hence, remember that when you're taking your notes, the patient's education, you have outlined it really well and you're very specific. Always remember your diets. Always remember about contraindications of medications. So maybe the patient is on a certain medication, they should not be on another one. So you are going to see these questions pop up. Last but not the least, number 8 is delegation and scope. Are you able to delegate actions that you should delegate effectively? Are you maintaining your scope of practice? These are important things that these questions are going to ask you. So if you're an RN, what can you delegate to an LPN, and so on and so forth. So know your nursing scope of practice. All right, so that is the 8 different styles of questions that you're going to see. And that is why most times you realize that your notes are not matching your exam questions, because it's not really asking you about the content, but how you are going to use the information as a nurse. It's all about your nursing actions, not about just the information, just the causes, the patho, and signs and symptoms. No, it's how you're going to use it. So now that you know that these are the 8 different types of questions that you can see in your exams, when you're studying, you have to add a layer of depth. You have to be able to talk to yourself. You have to be able to teach and reason and connect and make meaning out of what you're studying. And that's it for today. But remember that this whole exam thing doesn't end here. And that is why I took my time to develop an entire course on how to answer your nursing exam and choose the right option in 30 seconds. Literally, it's not just about knowing the different question types, but how to recognize them on your exam and what option is correct. If you're interested in my course, literally it's only 1 hour long. It's not that long, but it's so packed with so much information. All you have to do is click my link in the description box and use the coupon code YouTube, and you'll get some money off your order. I cannot wait to see you on the other side, and I cannot wait for you to take my course so that now you can excel in how to answer nursing questions. All right, until next time, take care.